Question is to the Minister for Health. What is the government's advice to Australians in their 50s who have had their first dose of AstraZeneca and are yet to receive their second? And how many Australians are in that situation?
The Minister for Health and Aged Care. Members on my left.
Thank you very much, Mr Speaker, and I thank the Shadow Minister. There are approximately 815,000 Australians who have had a first dose of AstraZeneca and are waiting for a second. Some in this room, in this chamber, will be in that circumstance. The advice, as provided both by ATAGI and the Chief Medical Officer, has been very, very clear that they should proceed with the second doses, as was the case when the previous advice was given. At all times, what we have done, and this has been one of the hallmarks of Australia's response, has been to follow that medical advice. The closing of the border with China, the difficult decisions in relation to the closing of the national border more generally, but also in particular with the selection of vaccines which were based on the advice of the Scientific and Technical Advisory Group led by Professor Brendan Murphy. We have followed all of their recommendations, both in terms of the source of vaccine, the quantity of vaccine, and also in terms of the application of those vaccines. So the advice given just before question time, both in writing by ATAGI and verbally by the Chief Medical Officer of Australia, is if you have had a first dose, no matter what your age, of AstraZeneca, please proceed with a second dose unless there has been a significant adverse contraindication.
Members on my left.
That is the same advice that was given in relation to others, and others at the time that the 50 and above age group was put into place. The reason why, as was explained by the Chief Medical Officer, is the global evidence is that there is a very, very low case level right around the world with regards to any adverse reactions to a second dose of AstraZeneca. I think that hopefully addresses the question. 815,000.